cause disease. So last lecture, it was a lot of just virus basics. How do they reproduce? How do they get inside the cell? Kind of how do they hijack the cell, cause disease? How can they cause cancer? Just background. The next couple chapters, which I think will take us through today's lecture and Monday and Wednesday. This lecture are all the different viruses that can cause disease. If there wasn't enough bacteria that can cause disease, now we're on to viruses that can cause disease. And just like bacteria, we're divided up into gram-positive bacteria and gram-negative bacteria. We divide the viruses up into DNA viruses and RNA viruses. There are a lot less DNA viruses than there are RNA viruses. So I plan on finishing this lecture today. This is my little flow chart on getting through the viruses. But the RNA viruses that take a whole lot longer will take us a minimum of 2 lectures. So there might be some outside recorded stuff time too. So the DNA viruses, that's why I'm like, it's small. And it's one of the exact same slides that's coming up. There are 7 families of DNA viruses that cause diseases in humans. We only cover 6, the top 6 that cause actual human disease. And even though they do all have DNA as part of their genetic material, we still group them, and there's a reason why they're in 7 families, 6 we talk about, based on what type of DNA they have. And so even if you notice on that little flow chart, which is just, this is the exact same little picture that's up on the next slide, we're grouping them, do they have double-stranded DNA, which is pretty normal. Our cells all have double-stranded DNA, and most of them do. But there is one family or group of viruses that have DNA, and sometimes it's double-stranded and sometimes it's single-stranded. And then there is a whole other group that just has single-stranded DNA. That's pretty unique as well. And then other than grouping them by the type of DNA they have, they're also subdivided based on if they have an envelope or not. They steal it from their host cell, a little bit based on their size, as well as what host cells do they attack, like where in the body do they attack. So this is how we group them. So this is how we're going to go through them. Sometimes the viruses get a little overwhelming on how many there are. And so I've had students that start to look like, I don't know where we are. You're still talking about viruses. Which is why I now print this off so you can have it. And you're like, oh, this is where we are. This is why we're still, we're still talking about double-stranded viruses. But you can just have it in front of you to kind of know where we're going. So we're starting here. We're going to work our way up and to the right as we go through the different viruses today. And we're going to start top left with our very first group, which is called the Poxviridae family. And again, we are only going to talk about the top viruses that cause human disease. There are some others, and I mentioned a couple in here as well. But the Poxviridae, again, it's that double-stranded DNA virus group. They are the largest viruses that are out there. They were the ones, if I go back to that last PowerPoint and you compare viruses to bacteria, out of all the viruses, they are the biggest. I mean, they're still really, really tiny compared to a bacteria, but there are our biggest viruses, at least. Most viruses in this group are animal viruses. So most of them are. And some of them can get transmitted to humans with close contact, and we're going to talk about a couple of those. There's really only 2 in this group that cause human disease, and it's the smallpox virus, which is my next slide, and molluscum contagiosum. They are both spread by inhalation and close contact, and they all produce some type of lesion, which gives it that name, that pox. They will sometimes, I'm like, oh, you have the pox. It causes these lesions of the skin. So it's a very visual virus. You know if someone's infected. It's not a virus that is ever asymptomatic. Pretty much if you have one of these viruses, whether it's the smallpox or the molluscum contagiosum, you will exhibit symptoms. And it goes through various stages. They go through what are known as macules, which right away on your skin, it just looks like, oh, it's got like a red spot. It's not raised up. It's not anything. You just have like red spots. Then it develops into papules, which just means now it's a raised red sore on your skin. When it gets into vesicles, now it starts to have fluid inside of these raised portions. And this is, we can start to see some of this progression. It's not the clearest picture of showing red spots, and they start to become raised, and they start to become fluid-filled. And when you get to that last stage, which we officially call it, nickname it the pox, or the poxviridae group, they become pus-filled. So we call them pustules. Visual, not very pretty diseases for either of these. But any of them are going to produce lesions, depends on kind of what stage did they go to. Now, the first virus in this group is the virus, it's officially known as variola. We know it as the smallpox virus. In this virus, when it gets inside the body, it infects internal organs. It pretty much gets in, it can really infect almost any internal organ in our body. It will cause damage to those internal organs. And it will cause a fever that is known to hit over 107. Malaise, you're tired. Delirium, that's probably part of the fever of 107. Smallpox is deadly. I mean, when you start getting to fevers that high, when you start getting to internal organ damage, it is a very deadly virus. Oh, so even if you survive, you probably have some type of mental issues when you get to fevers that high. Now, it does get spread, as it gets into the body, again, close contact, inhalation, it gets into the blood, which is never good to have bacteria in the blood, it's never good to have viruses in the blood, but they get in there, and they spread to the skin, which shows out those outward pox. You just don't see the internal damage. The really good thing for us is if we have eradicated smallpox. Like, it's gone. Like, you can't just travel somewhere and get it. It is completely gone. It is the one virus that we can still say we have eradicated it, because there are other viruses that were like, yeah, and they've come back. We've eradicated it. The main reason for it is that we had a really good vaccine. And there were several things in its favor. One, there were never asymptomatic carriers, which means you could fully isolate someone that was showing symptoms. If we compare it to COVID, a lot of people didn't have symptoms for COVID. And sometimes they were spreading it before they had symptoms. Smallpox, as soon as you've got symptoms is when you're infected, and we can isolate very, very easily. We also had a very, very effective vaccine, and we had lots of people that vaccinated. So we had a high enough vaccine rate. We were able to isolate, anyone that showed symptoms. Lots of things in its favor. So we've eradicated it. So do we vaccinate anyone for smallpox? Eradicating it or stopped vaccinated? I know I wrote down the date. I'm going to say 1970 something. 1972. So if you have parents or grandparents older than that, you can ask them, and they have probably been vaccinated. But the very last vaccines we gave out in the United States was 1972. No, I haven't been vaccinated for it. But there is one group of individuals we still vaccinate. Any guess? Military. That's why. Yes. Why did we talk about it? What were we talking about? Did we start talking about antibiotics? Well, we'll get it too. I was going to say, because I was like, man, you're right. I feel like we talked about this. So we still vaccinate only the military for smallpox. Oh, maybe I talked about the type of vaccine that it even was. Because the vaccine is a live virus, but it's attenuated, so it can't cause disease. And so if you're military, you're technically also immune to them. Because they are very, very close organisms to each other. Now, the other pox virus that has not been eradicated, so this is really the only pox virus that affects humans, is Molluscum contagiosum. Its official virus name is Mollusca pox virus. So it's got that pox in it. So it's going to go through one of those, skin, diseases. It just doesn't get all the way to that pustule stage. It kind of just gets to the papules where you had red dots and then they started to become raised. And they end up kind of as just like a shiny, they say waxy, they kind of look like shiny red, sores on the body. Where they show up, it tends to be generally anywhere you itch, is kind of how it's spreading. As you itch, you create abrasions, and this virus is going to cause these little papules there. And the top places you itch, your face, your torso, and your genitalia. And so these are where these little waxy pink papules are going to show up. The top populations that usually show molluscum contagiosum, children, because they just touch everyone. Not very clean. Sexually active adolescents, because it can get spread during intercourse. And then AIDS patients, because they are more susceptible to any kind of viral infection. Treatment, it will go away on its own. But you're going to have these like big red waxy papules, and they could be all over your face, like covering your face, and they'll hang out there for several months. And normally people don't like these big red things all over their face. So treatment, you can remove them. You can surgically remove them, kind of like a wart. We'll get to warts today. You can remove them. But it will go away on its own. It's not deadly. It's more of an inconvenience of a virus than anything else. Now, the other pox viruses that are in this group generally, again, are all animal viruses, meaning they cause issues in animals. But humans, if you have close contact with them, are starting to pick them up or can pick them up. And they usually cause a milder infection. They usually cause some sores on the skin, but not to the stage where it's deadly, not to the stage where it's going to be, unbearable. And the two that can or are documented go from animal to human is cowpox. And cowpox Edward Jenner was the one that had realized that individuals that developed cowpox, so milkmaids that were in close contact with these animals, and they developed these sores on their hands because of that close contact, were completely immune to smallpox. And so, there is still some debate out there. He's the one that is credited for developing the first vaccine, because he realized that he could actually take an open sore from a milkmaid, and it's that open sore that has the virus in it, but it's the cowpox virus, and he could give it to someone else, and now that person was immune to smallpox. Cowpox and smallpox, because they are in the same family, are close enough that if you have developed resistance to one, you've developed resistance to the other. Story goes that he tested this on his son, that he's took some little gross whatever from a milkmaid, from the little pustule, put it in his son, and then exposed his son to smallpox, which could have killed his son. But his son was immune, so yay for his son, but worst dad ever. But he realized that connection, that these are two very closely related viruses, but are not the exact same virus. Now, monkeypox, I always find it, again, interesting that monkeypox has now been in the news. Although I haven't heard anything too much in the last couple weeks, because I'd have students like, hey, we briefly talked about monkeypox. This is as much as I've ever talked about monkeypox. And now it's in the news. Again, I usually just quickly mentioned it. It gets my one word on one PowerPoint in this entire semester. Monkeypox is generally, again, found in monkeys, and humans can get it if they have interaction with monkeys. Not too many people with monkeys around us, so it's never been an issue. However, recently, just in the last several months, we've realized that monkeypox has gotten into humans, and monkeypox has changed enough. So viruses are always changing, mutating, that it's not just an animal virus and we get it from the animal, that once it gets into humans, it can spread from human to human. And it didn't used to spread from human to human. It used to be only animal to human. And we were noticing already, even before this last outbreak of monkeypox, we were starting to see more cases of monkeypox. Just in the last 5, 10, 15 years. Part of the theory why we're starting to see more monkeypox cases in the last 5, 10, 15 years is that no one's vaccinated for smallpox anymore. Because if you were vaccinated for smallpox, because everyone before 1972 was vaccinated for smallpox, if you're vaccinated for smallpox, you didn't get monkeypox, you didn't get cowpox, you didn't get anything, but now we've stopped vaccinating. Why? Smallpox isn't around anymore. That no one is immune to monkeypox. And so the the vaccine they have been getting to those that are at high risk of picking up this monkeypox virus is the smallpox vaccine. So if you ever have to get a monkeypox vaccine, just know it's a smallpox vaccine and you're now immune to smallpox. Again, smallpox has been eradicated though. shouldn't come back unless you get into the CDC and steal it. Shouldn't come back. Group of double-stranded DNA viruses, and it is our biggest group of double-stranded DNA viruses, and it's the herpes viridae group. And it's like, I'm going to talk a whole bunch about herpes. And everyone's like, oh my God, herpes. Because anytime they hear the word herpes, they only think really of the very first two viruses that I'm going to talk about, the human herpes 1 and the human herpes virus 2. But there are lots of herpes. So the herpes virus, it is double-stranded DNA. Its virus is linear. And it is the most prevalent of all DNA viruses. Approximately 90% of adults in the United States are affected with at least one herpes virus. As I go through, I'm like, that's, statistics. Several of us, most of us, have had at least one of these viruses at some point in our life. No, I haven't. Probably have. Again, you just don't think about them that it's in the herpes virus family, because again, you just know it as the name of the virus, not as the family that it's in. But there's a lot of herpes viruses. Problem with the herpes viruses, and problem for us, is that the viruses in this group can go latent. They can go dormant, they can incorporate into part of our DNA, and then they just hang out for years. I mean, they'll hang out for a lifetime. And then at some point, something's going to trigger these viruses to go active again. So these are viruses that once you've got it, it's going to stay with you. Now, their species name, again, we do get issues when we start to name species. They're not even like living organisms. But we call them the human herpes virus, and then we give them a number. So the human herpes virus 1, human herpes virus 2. The numbers are just when they were discovered. So nothing too more interesting than that. Now, there are 8 human herpes viruses that cause human disease, and we're going to talk about the most common 7 of them. And the first 2, the human herpes virus 1 and the human herpes virus 2, are the most commonly known, I shouldn't even say the most commonly known herpes viruses out there. They both cause slow spreading skin lesions. So you're going to have lesions on your skin. It used to be the simplex virus. And so you would still sometimes hear it called the herpes simplex virus. It's now officially called the human herpes virus 1 and the human herpes virus 2. And so there are 2 species. We talk about them together. The only real main difference between them is where they cause the slow spreading skin lesions. The human herpes virus 1 generally causes skin lesions above the waist, and the human herpes virus 2 generally causes those skin lesions below the waist, and this is usually going to be the one that is that sexually transmitted herpes. It's the same thing. They are still slightly genetically different, and they usually cause those lesions in different areas. Now, types of infections that they can cause. One is the oral herpes, which are the cold sores. Another is genital herpes. That, again, is going to be your human herpes virus 2. Ocular herpes, again, you just have the skin lesion near the eyes. A whitlow is very common as well for people that have the human herpes 1 or 2. And just because these are found generally above the waist and these are found generally below the waist, that doesn't mean they can't be interchangeable on where they can cause lesions. A whitlow is an infection on the hand. It's usually on the fingers. So it's not uncommon that people that have, cold sores, all of a sudden they develop these really kind of painful looking lesions on their fingers. Neonatal, neonatal, if a female has herpes, they can pass it on to infants and they can end up with skin lesions all over. And another one is herpes gladiatorum. Herpes gladiatorum, it is still going to cause skin lesions, usually causes that on the torso. And this is a herpes that's generally spread by wrestlers. Because wrestlers are always in very close contact with each other, and they can develop and pick up the herpes viruses that way. So they get the gladiatorum name, is because it's usually spread by wrestlers. Now, how it is spread, it is always spread by the active lesions. So if you are showing any of these lesions, you are potentially spreading the virus. If you are not showing these lesions, you generally are not, unless you are having any type of like fluid exchange. But it's those active lesions is where the viruses are. And so transmission is that if you are in contact, if you have any kind of cut, crack, abrasion, and yes, winter months with cracked skin, that's all open possible cuts and scratches and abrasions. If you get any of the virus from an open wound, touching someone, shaking hands with someone, kissing someone that has an active lesion, and it gets into any kind of cut, any kind of scratch, any kind of abrasion, that's where you pick up the virus. Once it gets inside the body, it forms inside the cells, because again, it's a virus, it has to get inside the cells. Once it gets inside the cells and starts to hijack them and reproduce and make those cells virus-producing factories, it will actually cause infected cells to fuse together. And that fusion of infected cells is called a syncytia. That's great for the virus, because if it fused all those infected cells together, it is now like one massive virus-producing factory, and it provides them a little bit of protection from the immune system as well. Now, the human herpes virus 1 infections, the top spreaders are children. Again, kids give kisses to everyone, and they're dirty and all that stuff too. Human herpes virus 2 infections are most likely spread by sexually active adolescents, are the top spreaders. That doesn't mean anyone else can't be spreaders of either of these. They definitely can, but those are the top spreaders of these viruses. Now, diagnosing someone with this virus, they generally just go by the characteristic lesions. Oh, I see you got a lesion around your lip. Human herpes virus 1. And say, there's really nothing to get rid of the virus out of the body. We do have some drugs that make those, that try to heal those lesions up faster. Again, if you can heal the lesion up faster, one, you feel better because you don't have a lesion on your face. But if that lesion is gone, you're no longer spreading the virus. And so we have chemotherapeutic agents, aka drugs. So cold sore treatments, Abreva. Its name, Abreva, is because it wants to shorten the length of time you have that cold sore. The idea is it does not get rid of the virus out of the body. The virus is with you for life, but at least it will shorten how long you have a cold sore. Best prevention is if you don't already have the virus, making sure you have gloves when you're in healthcare so you don't have contact with any open lesions. If you have a whitlow or an infection, make sure you're wearing gloves so you're not spreading it. Prevent the human herpes virus 2, sexual abstinence. Can't even say condoms because as long as any skin is touching and there's an abrasion there, it could be spreading. Human herpes virus, again, most people don't think of it as a herpes virus, is the varicella zoster virus. And it's called the varicella-zoster because it causes 2 different diseases, even though it's one virus. And the 2 diseases it causes is varicella and herpes zoster. Varicella, no one usually thinks about this particular disease because they normally call it chickenpox. And children are the top individuals that get chickenpox. Although now we have a vaccine. I've had chickenpox, which guess what? Got herpes in my body. I have human herpes virus 3 in my body because if anyone that's ever had chickenpox, the virus is in the body. So children are generally the individuals that pick it up. Again, kids are touching constantly, kissing everyone, hugging, little kids, oh, grandma, kids, whatever. Children spread this virus like crazy, and before vaccines. The issue is once you've had chickenpox, the virus is in the body. It's in my body right now. At some point, that virus, because it's latent, is going to become reactivated, and it causes a different disease. Same virus, different outward symptoms, so it's different disease. And it causes herpes zoster, it gets its name, but it's more commonly known as shingles. And the interesting part is when it reactivates later on in life in adults, is that it becomes reactivated along spinal nerves. Oops, I'm going to get to my picture. I'll go back. So the virus just goes dormant and it hangs out, so I can use my stuff because it's hanging out in my body right now. and it's going to become activated just along a spinal nerve. And in AMP, you had to learn all the spinal nerves. But whatever spinal nerve it becomes reactivated on, whatever skin that spinal nerve controls is where you're going to get a very large, very painful rash. And it's why there's usually a line. The rash is usually in a line. It's because this line, this part of the skin, is all controlled by one single spinal nerve. And so it's one of those like, oh, why is it a line? Oh, that skin is controlled by the same spinal nerve. And that's the nerve that this particular virus reactivated on. So how it's is very easily spread, which is why everyone, before a vaccine, pretty much at some point got chickenpox as a kid. It's highly infectious, coughing, it's spread by respiratory tract. It's found in the conjunctiva of the eyes if you touch your eyes and then touch anything. And it causes the characteristic skin lesions, the little pox that are all over there. Now, we call it chicken pox, and we partly gave the name because of the red lesions, but is chicken pox in the pox family? No. The pox family has smallpox and molluscum contagiosum, and it's got cowpox and it's got monkeypox, but chicken is not a pox virus, even though we call it chickenpox. It's not a pox virus. It's a herpes virus. Now, when children get chickenpox, they generally get some really itchy lesions that can last a week. It's annoying. Have the calamine lotion, super itchy, but then it goes away. You might have a slight fever, tired, your body still has a virus in it. Adults that get chickenpox, again, as an adult, your immune system is stronger. You're going to have a stronger immune response. And adults usually are going to have extreme fevers, much higher rash. They're going to be, a lot more effective. That usually adults that pick up chickenpox are in the hospital. And so this is why if you have ever had, I know I asked you this when we talked about titers. Has anyone else in here had chickenpox? You guys all got the vaccine? I was going to say, so you, going into nursing, will have to have a titer done, because if you've had chickenpox, there's no documentation you've had chickenpox unless you went in and got diagnosed. No one ever did. I mean, maybe you did. My mom's like, oh, whatever, you got chickenpox. And they just want to make sure that if you've not been vaccinated, because you had it, you should still be just as immune, but we want to make sure that they will do the titer to see that you actually have antibodies against it. Because if there is no record of it, maybe it really wasn't chickenpox that you had, and now you go into a hospital setting and you are exposed to a patient with chickenpox that you can easily pick up because it is very infectious, you could then be hospitalized. So that's why they do titers on healthcare individuals. Now, again, that shingles or the herpes zoster reactivates along that spinal nerve, but there are some things that we can do about it now. We do have some vaccines that can actually prevent that reactivation. I'm going to backtrack. Diagnosing it, chickenpox, they just look at the lesions. Shingles, we can see those characteristic lines of rash, and we can go back on past history. Oh, you have chickenpox? Now you have shingles. Treatment, chickenpox will go away on its own. It's annoying for about a week. Shingles, you're going to manage those symptoms. Those rash can last for months. I've known enough people that have had shingles. Very painful lesion, can last months. And so you're just kind of managing the symptoms, trying to put stuff on it, creams to try to help it not hurt so much. My grandmother-in-law, so my husband's grandmother had it, and it reacted right on the back of her neck. And it can be any of the spinal nerves. And so like any shirt she wore, like rubbed right there on it. So it was very painful for a very long time for her. Now, prevention's difficult because it's out there. However, we now have vaccines, one to prevent chicken pox, because if you have a vaccine for chicken pox, will you guys, and I said, you five, will you guys get shingles? Nope. If you've been vaccinated for chicken, you've technically also been vaccinated for shingles. But that still doesn't mean that we won't get shingles, because there is a vaccine for shingles now as well. It works a little bit different. The idea is that the virus is already in the body. We can't prevent that. But this particular vaccine kind of wakes our immune system up. It's just like hey, remember that virus? If it ever reactivates, this is what you need to do. and it kind of slows that reactivation process. Now, there used to be a vaccine called Zostavax. This was the original vaccine, Zostavax, and it had about a 50% effectiveness rating. And for a lot of people that are already kind of somewhat anti-vaxxers, a 50% effectiveness rating isn't great. I'm one of those, I'm like, 50% chance you won't get it, or if you don't get the vaccine at all, pretty good chance you're gonna get it. Might as well, get it anyways. But just in the last, I want to say 5 years, but I think it's like 7 years now, we developed a much more effective vaccine called Shingrix that's 90% effective at keeping that virus at bay. So if you've ever had chickenpox, you're going to get highly recommended to get that Shingrix vaccine. I know it came out, I want to say like 5 years ago, because when it came out, there was like a waiting list. They couldn't produce it fast enough. It was kind of like COVID. They just couldn't produce it fast enough. And it was so effective, and they were giving it to like every elderly person over 50. But they were like, everyone should get it. I mean, if you've ever had chickenpox, it's guaranteed at some point it's going to reactivate. And so they were vaccinating everyone. I have known people, they usually say it's over 50 is when the vaccine or the virus starts to reactivate. I've known people that it's reactivated in their 20s. It's usually something triggers it, like some random thing. I don't know if I've got any more. Nope. Something will trigger it to become reactivated. My grandmother-in-law, her doctor told her it could be as simple as a mosquito bite could reactivate it. Just something to your body that your body is like, let me go fight this. And then all of a sudden the virus is like, immune system's distracted. It can reactivate. But age is going to, in itself, can cause a reactivation. There you go, 2 dose. What? And then you're good. And so, I mean, I'm super happy. I don't know when they're going to recommend it, but I'll have to give it. I'm not that close to 50, but I don't know what the age is that they start telling everyone to get it. But I know some people that, yes, have in the 20s that have gotten it, and so they have been approved to get the vaccines. You got to get approved for your insurance to cover it. They've been approved to get it earlier. The next herpes virus that maybe you guys have had at some point in your life, or you've probably known someone that's had it, is the human herpes virus 4, also known as the Epstein-Barr virus. This is a virus that it affects the immune system, and it is spread via saliva. So the highest concentration of the viruses is found in saliva. And so it's spread through any kind of saliva interaction. So it's normally known as the kissing disease, and it causes the disease infectious mononucleosis, but that's a lot to say, so we generally just call it mono. And so we just shorten it down to the mono. And so mono is also known as the kissing disease because it's spread by saliva. But that doesn't mean, I've had people that are like, oh my God, I got mono, I didn't kiss anyone. No, but if someone that was infected drank out of a glass and then you also drank out of that same glass, maybe not knowing, and I'm like, it could spread that way as well. Now, once you pick it up, because it is spread by saliva, it will get into the epithelial cells. It is going to spread throughout your bloodstream, and the cell that it wants to get into and hijack are our B cells, which are our immune system cells. So our B cells are now under attack. So your immune system, the thing that's supposed to go out and fight all these things, is now infected with the virus. And so your cytotoxic T cells, their job is to recognize intracellular viruses. And so their job is to see that the B cells are under attack and start to kill them. And so infectious mononucleosis, or mono, you have T cells killing B cells. These are both cells of the immune system, and one is killing the other. And so they call it a civil war because they're the same immune system. Well, one cell is killing another cell. And because your immune system is under attack and it's killing itself off, this is where you develop all the symptoms of mono. You've got super tired, achy, your spleen is enlarged because you've got all these cells that are going there that are getting killed off. Fever, sore throat, All your characteristic symptoms, that's because that's all from the outward manifestations of your immune system is under attack. It can also cause more extreme diseases as well. If people that are already T cell deficient, so they already are immunodeficient before they picked up mono, it can cause some extreme diseases. So these are some of the extreme diseases. If you have no immune system whatsoever, this could be HIV or some other severe immunodeficient issue. It can cause actually a cancer on the tongue called oral hairy leukoplakia, that you get little sores on your tongue. If you have a poor immune system, so it's immunocompromised from something, you still have an immune system, but it's a poor immune system, it can cause Burkitt's lymphoma, it's cancer of the lymph nodes. It can cause nasopharyngeal cancer, chronic fatigue syndrome, and Hodgkin's lymphoma. Right now, these are like, not proven, but we're pretty sure that this particular virus can cause that. When I say a normal immune system, I'm saying in kids. When I say normal, I don't mean like you've got an awesome, super hard-working immune system that's like seen and experienced a lot. It's like it's normal. There's nothing wrong with it. It's just not super developed yet. Usually asymptomatic. So little kids don't generally show symptoms of mono. That doesn't mean they don't have the virus in their body, but their immune system isn't super developed, which means your T cells are really not reacting to those infected B cells, and you don't have that huge civil war, so then you don't have all those outward symptoms. So it's normal that kids do not experience the symptoms. Again, they still have a normal working immune system, it's just not super developed yet. Once you have a super developed immune system by middle school, high school, so you have a vigorous, super awesome working immune system, the better your immune system is, the better the civil war is happening, and that's when you develop the symptoms of mono. So it's usually, I was going to say, the most times that people are getting symptoms of mono or developing mono is the adolescent age. I'm like, oh, this person is this person, and they now also have a very strong immune system. Now, diagnosing something, it can go by all the characteristic signs. Oh, my boyfriend had mono, and now I come in and I'm fatigued. My spleen is really sore because it's enlarged, and you can actually touch the spleen. It's over on the left side of your body, and you'd be like, wow, that's, it's sore to the touch. The sore throat, and a lot of times they'll eliminate, it's not strep. So they go based on all your symptoms, but they can do a really simple test as well. The same exact company that makes our test that we ran on our strep throat makes a test for mono as well. You just put a little spit in there and it will show the 2 lines you have mono. So super, super quick, easy test. Treatment, well, if you've got some type of cancer caused by it, one of the rare immunodeficient immune systems, you could do a chemotherapy. Your normal mono, you just treat symptoms. Okay, go home, get rest, take care of yourself. Stay hydrated. Any other conditions, there's really nothing we can do. We don't have antibiotics. Antibiotics are just for bacteria. We don't have a lot of antivirals on the market that are really effective. We've got a few for different viruses, but we don't have a lot. Your best bet is prevention. Stay away from people that may be exhibiting symptoms. Making sure good hygiene, don't share cups or toothbrushes, which that's wrong and for other reasons. But as long as you're just not sharing stuff, you can avoid mono. The herpes viruses is human herpes virus 5, known as the cytomegalovirus, and it's called cytomegalovirus is because when it gets inside of cells, it causes the cells to enlarge, and so that's where the cytomegalovirus is. And not only does it cause the cells to enlarge, they end up usually with 2 dark staining, called inclusions. I don't know if I have that on there. Little dark staining inclusions that they say look like little owl's eyes inside the cell. It's a very common virus. About 50% of adults in the United States have this virus, which means some of us have it. It's spread by any and every bodily secretion that we can have, which is why 50% of adults all have it. But the majority, like over 99% of us, it's asymptomatic. Whatever, we don't care. We don't care about things that are asymptomatic, even though about half of us are carriers of it. But it can cause a lot of very different and unique complications. It can get into fetuses and cause various types of deformities. It can cause in newborns, it can cause mental issues in newborns. It's sometimes been known to cause blindness in newborns. Some other ones. Anemia in newborns. It can cause jaundice in newborns. I mean, there's other things that can cause jaundice in newborns as well. If you're immunocompromised, it can cause pneumonia. And by the time you're diagnosed with any, you'll be like, oh, whatever, you're blind. It's caused by this. There's really nothing they can do at that point. And so mostly asymptomatic. I had one student, it was years ago now, that had a daughter, I want to say she was like 10, somewhere around that age, that was having tons of very unique issues, like, and lots of medical things. She was like at Mayo like every week, trying to diagnose her daughter, and they finally figured out it was a cytomegalovirus. And unfortunately, there was really nothing they can do, but she was having like inflammation on the brain, but then that would go away and she'd have something else, and it was like a ton of issues. So it can cause very unique, random complications. So it's one of those, almost it gets to the point of, we don't know what's wrong with this person. Maybe we should test them for this. Fortunately, even if you have an answer, there's really not a lot you can do with it. So diagnosing, they can try to look in tissues. They have to take a tissue sample. They can look for some of those enlarged cells. Otherwise, we do have ELISA tests that can test for it. We've got PCR that can detect this unique DNA. Treatment, fetuses and newborns, by the time they've been diagnosed with some issue with this particular disease, there's really nothing they can do. It is known to cause some different types of eye infections, and we do have an antiviral that can help with it if it's causing an eye infection. Otherwise, prevention. I mean, it is spread by like any bodily secretion. It's spread in saliva, it's spread in sweat, it's spread through sexual intercourse, it's spread, anything. So some of our best prevention, abstinence, safe sex can help it, but really, there's really not a whole lot we can do. It's spread everything and everyone. Don't touch anyone. The last two is human herpes virus 6 and human herpes virus 8. There's not a lot I talk about them, so they both went on my same slide. Human herpes virus 6 causes a condition known as roseola, usually only found in infants, and it just causes an infant to have a pink rash. There are lots of things that can cause newborns and infants to have a rash. The unique part about it is that it is just a pink rash, and it usually is just right on the torso, like right down the middle. So the rash usually doesn't go out to their hands and their arms and their fingers and their toes. It just kind of goes right down the middle of their body. And it's a pinkish color, so it's not like a bright red or anything else. It just is a pink, where it gets its name, the roseola, that it's like rose colored. Right now, they do think there's a possible link. Again, it's still in, stages of study. They do think there's a possible link for this virus maybe leading to multiple sclerosis later on in life, but they're still looking at the links. Obviously, they're not going to expose a bunch of people. Hey, let's give you this virus and then see if you develop MS. They go back, past patient history. And then the last one, the human herpes virus 8, only affects individuals that have absolutely no working immune system. So those would be the ones that are in the AIDS stage of HIV infection. And the virus will get into the blood vessels and causes a cancer on the blood vessel walls. And so places where we have very thin tissue, where blood vessels are very evident, is in the gum line, and then they end up with cancer, very evident in the mouth. But because it causes the cancer of the blood vessels, you'll have bursting blood vessels like everywhere because you've got cancer along all the blood vessels. It's rare, and it only affects those that have absolutely no working immune system. Lots of herpes. More than you ever wanted to know. Group, still our double-stranded DNA, is the Papillomaviridae group. And it's known for causing infections known as papillomas. And a papilloma is more commonly known as wart. Now, what a wart officially is, defining, is just a benign The benign means it's not spreading. So all of a sudden in one particular area in your epithelial tissue, the cells just started to grow like crazy, and then they just stayed right there. They're not spreading. And you can get these warts anywhere on your body. You can get warts. They can be painful, depending on where they are. They're generally not pretty. I've got lots of pictures on my next slide. And some of them, depending on the warts, and we'll talk about it, that can cause genital warts, also put you at an increased risk of different kinds of cancer. They are generally transmitted by skin-to-skin contact. The virus still does have to get into the body, so it does have to be skin-to-skin contact with some type of open abrasion. So some type of crack in the skin, any type of crack in the skin. And so it's easily spread just by skin-to-skin contact, that you can even do what's known as auto-inoculation. If I had a wart on my finger and I started touching other parts of my body, I can be spreading that virus to other parts of the body, and I can end up with warts anywhere I'm touching. So you're like inoculating yourself in other areas by touching that wart to other areas as well. Now again, they can be anywhere. One very, I say common, even kids have had them, are warts on the bottom of the feet. They're called plantar's warts. And there's multiple ways you can get rid of them, but they can really be anywhere. There are lots of strains of papillomaviruses. So papillomaviruses can cause warts, but they are not the all exact same strain, which is why just because my daughter had a plantar's wart does not mean she's going to develop some type of cancer from that. That's another strain that can cause warts. So diagnosing it, usually you can see the wart. I mean, there are other ways we can diagnose, but they're generally not going to do some type of PCR or an ELISA. They're just going to look at the wart and be like, you got a wart. If they're harder to see, depending if it's on the genitalia, they might have to do a pap smear. Treatment, we want to remove them because it's that wart, just like the papules, that's where the infectious viruses are. And there's lots of different ways that you can remove them. You can burn them off, you can freeze them off, you can cut them off. I mean, there's lots of different things. There's different types of chemicals you can add to it that make them go away. We tried all those. Both of them, I think we tried the chemicals, and then we froze them off at the doctor's office. Lots of different ways to make them go away. If they cause some type of cancer, well, then you're going to have to go through some type of cancer treatment. Prevention's difficult because lots of people are carriers of these, and they're very, very easily spread. Plantar's warts are very common in kids because it's not uncommon for kids to be like, oh, I like your shoes, let me try them on. They're always trying on kids' shoes and putting on other kids' shoes. And as long as that virus is in there because one person had a wart, the virus is in there and can spread it. The ones that are spread through sexual intercourse, abstinence from mutual monogamy, and we do have a vaccine for some strains. We have got that HPV vaccine, which stands for the human papillomavirus vaccine. And so we do have a vaccine against some strains that prevent some of these genital warts. And so a lot of times people are like, another vaccine. Although not all HPV is going to cause cancer, if someone did pick up the strain that can, doesn't mean it's for sure going to cause it. You can be like, but you're not going to get genital warts. And they're like, okay, I don't care about cancer. I don't want genital warts, and then they'll get vaccinated for it. Our last strain of our double-stranded DNA viruses, who knows, maybe you guys have had some of this already, just even this year. It's the Adenoviridae group. And most of the viruses in this group cause the common cold. Now, there are over 30 strains of viruses in this group that cause the common cold. But there are so many other viruses that we'll talk about as well that cause the common cold. The common cold is not a definite, well, it is an adenovirus. We'll talk about it, I don't know if it's Monday or next Wednesday. We are going to get into coronaviruses, but there are viruses in the coronavirus family that do cause the common cold, as well as others. But there's lots of strains from this group too that cause the common cold. It's spread by respiratory droplets, and so it usually gets into the respiratory tract. It causes the coughing, the congestion. It can get into the intestinal tract and cause a common cold. You're coughing, congestion. You also have some diarrhea with it. And it can get into the conjunctiva of the eye and cause pink eye. Now, I learned the hard way. You can have bacteria that causes pink eye, and you can have viruses like an adenovirus that can cause pink eye. Any guess how you can tell the difference? If my kid has pink eye, can I tell it if it's a viral or a bacteria? Any guess how? The gunky stuff. Bacteria pink eye causes the gunky grossness. Viral pink eye does not. It just causes it pink. Why this is important to know is because only one of them is treatable. Bacterial pink eye, antibiotics, it will go away. Viral pink eye, you have a cold, they're going to send you home and charge you $200. I learned this the hard way. My kids got pink eye, they can't go to daycare. I take my doctor, all right, kids got pink eye, go to the doctor. Your kid has pink eye. It's not bacterial, it's viral, go home. They have a cold. Okay, thank you for the $200 bill for telling me that. So if you've got kids and they have pink eye and it's not all gunky, it's viral. They just have a common cold. It will go away on its own. And unfortunately, you still can't send them to daycare because their eyes are still very, very pink. We do have an attenuated vaccine that works against some strains of our adenoviruses that military personnel are usually giving it to it. It just decreases how many common colds they have while in the military. Because obviously we don't want them sick the entire time. It's just not the most effective vaccine. It doesn't work for a very long time. And it only works against some strains of adenoviruses, which means there are a whole bunch of other viruses that can still cause the common cold as well. It just decreases how many viruses you have. Next group, there's only one group that has part double-stranded DNA, part single-stranded DNA, and it's Hepadnaviridae family. And it causes hepatitis. So anything that has hepad or hepat anywhere in the name means liver. So Hepadnaviridae, you know it's going to affect the liver, and it's a hepatitis B infection. So we will go through hepatitis A, B, C, D, and E. 5 hepatitises. They all cause inflammation of the liver, hence the word hepatitis, but they are caused by different viruses. And so the only ones that we're going to talk about today, because they're the only ones that are DNA viruses, is the hepatitis B, and then I also mentioned it with hepatitis D. All the other hepatitises are all RNA, which we haven't gotten to yet. So this particular virus causes the hepatitis B. Hepatitis just means liver inflammation, and your typical symptoms of having a hepatitis infection, or one of the most obvious one if your liver is having issues, is you're going to have jaundice. One of the easiest places to diagnose someone that has jaundice is look at the whites of their eyes. Because some people, depending on their skin tone, are, have a yellowish kind of tinge to it. And if it's not a super, bad jaundice infection, might not always be easy to see or catch. But the whites of the eye should always be white. So it's one place that we can detect jaundice. They're usually going to have pain in the abdomen where their liver is. The liver is huge. And if it's inflamed, it's going to be very painful to the touch. They usually can have a fever as well. Again, their immune system is still trying to kick in. They're usually going to be tired as well. Again, your immune system's at work. Now, hepatitis D, I don't talk a lot about it. Hepatitis D in itself cannot cause disease unless you also have hepatitis B. So hepatitis D can cause hepatitis. It's part of its name, and it can cause very horrible infections to the liver. only if you also have hepatitis B. And the reason for it, hepatitis D, it is a virus, and viruses should normally be able to hijack a cell and make the cells mass produce them. Hepatitis D can't do that on its own. So hepatitis D actually needs the machinery from hepatitis B for it to get reproduced. And so you cannot suffer hepatitis D infection unless you also have hepatitis B. So it's called a co-infection. And when you have the two together, it can be deadly because it can really devastate and destroy your liver. And even if you survive it, you're more likely to get a liver cancer later because of the damage that it did do while you were infected. Now, hepatitis B, how you can get it, most of the viruses, the highest concentration, are found in saliva, semen, and vaginal secretions. So how it's transmitted is transmitted through sexual intercourse. It is transmitted through any kind of kissing. It can be transmitted, sharing stuff. But because it gets into the blood supply as well, it can be spread through any type of sharing of needles. It's usually some type of fluid interaction is how you're going to pick it up. For a lot of individuals, asymptomatic or mild symptoms. A lot of individuals don't even go to the hospital or even realize that they've got hepatitis B infection. Luckily for us, we have a vaccine for it. It's a 3-vaccine series, and it's an extremely effective vaccine. They say, as of right now, they can say, for sure it's going to work for at least 20 years of your life, if not your entire lifetime. It's going to provide protection for you. Those that do get it, even if you survive everything, even if you had asymptomatic or mild symptoms, it's still got into your liver. And anytime you cause inflammation anywhere in your body, it's still causing damage, which always is going to put you at a higher risk of developing liver cancer or whatever area in the body it affects. Diagnosing it, what they're going to look for are the viral antigens. So the little fragments of the viruses, and the little fragments of the viruses, as the cell is making all the parts, they call them little Dane particles. And these little particles get all assembled to make the full virus. So they're going to look for just little viral particles. Treatment, it's treating symptoms. There is no universal treatment for someone that's got a hepatitis B infection. We can't just be like, oh, plug it into the computer, hepatitis B infection, what should I do? They're going to be like, maybe depending on their age, depending on their symptoms, depending on this, depending on this, depending on this, try this, then maybe try this. We do have some antivirals that can work. It's surprising even if you bump up vitamins in their diet, seem to actually decrease symptoms as well. But there's no universal treatment that just is like, here, this is going to work. Your best bet is just to not get it in the first place and get vaccinated because it's a very effective vaccine series. Otherwise, abstinence, monogamy, universal precautions, making sure good hygiene, wearing PPE, things like that will decrease your chance of picking it up. And then our very, very last virus, it's a single-stranded DNA, which is unique all in itself because DNA is double-stranded. It's just single-stranded DNA, and it's only one virus that affects humans. There's other viruses that affect other organisms out there, but only one virus that affects humans. It's called the B19 virus. It has alternate names as well. So it's a single-stranded DNA. It's the smallest of the DNA viruses. There are smaller RNA viruses, but of all the DNA viruses, it's the smallest one. And viruses in this group generally cause a lot of different animal diseases. We're not studying animals in this class. You're in veterinary medicine, you could. But the one virus that does cause issues in humans is called the B19 virus. And it causes a condition known as erythema infectiosum. And the erytha means red. And it causes the skin, particularly the cheeks, to become very, very red. It can cause a rash on the body as well. But it's the red rash that's the most unique part of it, because lots of things can cause rash in infants and children, and this usually only affects infants and children. Now, it has alternate names as well, so it's called erythema infectiosum. Again, it's red. That's where it gets its name. Also called the fifth disease, and it's because in 1905, before we had internet, before we had WebMD, if you were a doctor and you're like, I don't know, a kid just came in with a rash, you had lists of everything, and this was listed as number 5 on the top causes of childhood rashes. So they called the fifth disease. It's fifth on the list of things that can cause rashes. So the name kind of stuck, that it's also called the fifth disease. Another lesser known and lesser called name for the disease is called the slapped cheek syndrome. And it's just because the cheeks get so red that it's also called the slapped cheek syndrome. No, we're trying to get away from that, just negative connotation. But I get where they get the name. Now, sunlight will aggravate it as well, but it normally just causes this redness of the cheeks and a rash on the body, usually just in children, and it usually goes away within about 1 to 2 weeks, and it doesn't generally cause any long-lasting effects. Another virus that can cause disease. Oh, and right there. That's my last slide. So, lots of DNA, but there are even more RNA viruses that we're going to start on Monday.